So first of all, I want to just mention that we are going to flip the agenda. Erin has generously agreed to present about the annual economic impact of a comprehensive child care system for Vermont a little bit later, and we'll start with COVID recovery metrics. And then in the middle, we'll do some updates. Before we get to that, let's go around and introduce ourselves. This is an awesome group of people. And as I said, introduce yourself, name, organization, and then a compelling or surprising piece of data or an indicator, etc. So I'm Dora Levinson. I am the Research and Data Director at Building Bright Futures. And shameless plug, we did a data brief on exclusionary discipline, and there was some really interesting information about the disproportionate impact of suspensions for children who are receiving special education on an IEP. And again, all sorts of limitations, but that disproportionate impact, both for children on an IEP and eligible for free and reduced lunch, was definitely an important finding for future considerations and research. Morgan, do you want to go ahead and introduce yourself?
Sure. So Dora stole mine, so I'm going to present something that no one's heard of yet. So I'm Morgan Crossman. I'm the Executive Director at Building Bright Futures. I also hold a faculty appointment at the Department of Education at the University of Vermont, and am just obtaining in the next week a research affiliation appointment at the Center for Disability and Community Inclusion at UVM as well, which is really exciting. So folks may not know, but Building Bright Futures has been partnering with the Child Development Division and Children's Integrated Services to produce a data brief on families' experiences with CIS. So not yet to be shared, embargoed information, but one of the very cool things that I want to report about this is that there was overwhelming support about the impact on child development outcomes and parent competence, and how the program was supporting parents' abilities to meet the needs of their kids, to understand, to advocate, to be actively taking what they are hearing and learning and implementing it to support their developmental needs, which is very cool. And another piece that I really love about this data brief is that it will also talk a little bit about two important components of CIS, specifically care coordination and the team and the staff that are providing services as two of the most concrete components of the program. So embargoed information, we are writing up the data brief right now, and we're really excited to publish, but super fun.
Hey, Morgan, can I just jump into,
Sure.
We should probably clarify that that data is from the EI Family Survey, the early intervention. So it doesn't cover all of CIS, but that set of services.
Correct. And it is so very clear in the brief, all of the limitations to the data and how we should really be thinking about data on children's integrated services and all the discrete components and what that truly means. But it's an exciting first look at a very small concrete portion of data. Anne, do you want to go next?
I'm Ann Dillenbeck. Good to see you all again. I'm happy in my new role as CIS Program Improvement Manager to be able to attend this meeting, which I didn't really, it wasn't really part of my job in my previous role with STARS. So I just started in that role a week and a day ago. And so I'm feeling my way, and I do have some things, a couple things to share about COVID metrics, but I don't have an exciting piece of data right at the top of my head. Glad to be.
Thanks, Anne. Kate, do you want to go ahead?
Which Kate?
Yeah, there are a bunch.
There are always Kates. I can go. I can't think of a data point right now. I have been doing data analysis, but it doesn't feel like anything's ready to share. And so I'm trying to get out of my own head. I know, Erin, I know. I've like been like swimming in it. I'm so sorry.
Your statements from yesterday, Kate, about the importance of indicators and thinking about systems change.
Yeah, so okay, well, I can do that. Also, I'm Caitlin Northian from UVM, and my brain is fried. Hello. It's like the third Friday of the week somehow. Yesterday at the systems analysis meeting, we were talking, there was definitely interest in holding the government accountable to any changes that are made and thinking about what kind of metrics we could use. And there's a lot of focus on child outcomes, but when we think about evaluating a state government system, we really want to think about the functions that it does. We want to think about how it's serving its community. And we don't want to place all of our bets on child outcomes alone, because those are going to take a lot of time and coordination to actually be visible. And so thinking about all of the metrics, then all of the rich data we can gather related to the workforce, related to staffing, related to communications, it's just really exciting and helping to push people's thinking.
I should have had you go last so you could frame the next discussion, but thank you. Dave, you're unmuted.
Okay, hi, I'm Dave Kelly. I'm from the Agency of Education. I'm a research and statistics person there. What I think before I say anything about the data point, I should say that whenever someone from my team comes to me with an unexpected statistic result, the first thing I make them do is go back and check it, because it's really exciting to statisticians, and sometimes a lot of times it can be wrong. But building on what Dora had said, for the suspensions and expulsions, if you were to use the historically marginalized, historically advantaged category, it really shows that the entire discipline system is biased to those that are marginalized in some sort of way. And just for those that may not be as familiar with that, historically marginalized means anyone that is on an IAP, free and reduced lunch eligible, which is our income measurement, is an English language learner or is a racial category that is not white in the state of Vermont. Sometimes it also includes things like migrant and foster care status, but it doesn't for this particular one, but it does for the assessment results. Sorry for the long explanation, Morgan.
All right, let's popcorn style. Renee, you go next and then we'll keep moving.
Sure. Good afternoon, everyone. So nice to see you. This is a big, a virtual room full of big, beautiful brains. So just check in, like my energy, like you said, Katie, like it's the third Friday of the week. My energy is low. I've been a grumpy gills. My kids are also home. And it seems like from this morning, like I just woke up on the wrong side of the bed. So if I come off catty today, it's not anything you all did. It's just me stewing over here in my own world. So I'm the director of the Vermont Head Start Collaboration Office, which sits within the Child Development Division. And I'm going to pull some qualitative data that I heard from a VHSA meeting I attended a few weeks ago. I think there were at least 3. Well, we were short a Head Start program. So there were 3 out of the 6 programs that were there that actually reported that they have numerous classrooms. Again, it's qualitative, so I don't have hard numbers, but they've got numerous classrooms right now where 100% of the children in the classroom are on IEPs. And that to me, in this conversation around discipline and exclusionary practices, and just thinking about how we support teachers and how we support students, that's just a really hard-hitting statistics for me when I think about the workforce and I think about the stress and how much folks are really trying to juggle. Hey, Claire. And so just this idea that we've got, 23 to 5-year-olds maybe in a classroom and everyone is on an IEP, and the challenges that presents to the field right now. So Hopefully folks saw that the Dear Colleague letter that came out from ACF yesterday in terms of social and emotional supports for children. I can pop a link to that in the chat for folks who haven't, but certainly feels like a call to action in terms of how we're responding to needs and supporting needs of both the kiddos and the teachers. So, and just an aside that yes, we also don't have childcare this week. So there's one floating around my kitchen right now, and he might make an appearance, and I might have to shut off camera and go break up a sibling fight. But that's just what we're working with in the house today.
Erin?
Oh boy, I feel like I'm in the hot seat. Everybody's talking about really important issues, and I'm going to give some really relatively light data, but also that's because I feel like if I'm going to talk about this economic report later, I don't want to like totally, the other data I can think of is related to that, and I feel like that's just too much. So I have been writing a lot of evaluation reports the last month. And so I just am noting that, so most people know that Let's Grow Kids, oh, sorry. I'm Erin Roach. I'm the Director of Operations and Evaluation at Let's Grow Kids. I was supposed to say that right off the bat. So anyway, so Let's Grow Kids is known for its like policy development and advocacy, also for the Make Way for Kids grant program, things like that. But you might not know that we do a lot of technical assistance in the course of all of this. And so I was counting up for one of these grant reports, all of the webinars that we conducted over 2020 and 2021, because that's what the funder, one of the things they were helping to fund. So I just wanted to say we did 64 webinars in 2020 and 2021 aimed at early educators and like childcare program administrators. And what did I come up with? 33 of them out of the 64 were related to health and safety, including developmental screenings, like 15 of them about developmental screenings. But also 12 of them were about business and like how to keep your childcare business working, how to make the like ARPA funds, PPP loans, all those kinds of things that throughout the last 2 years. So anyway, I just wanted to mention that because it's a little bit different, a little novel. Yeah, there you go.
That's awesome. Thanks, Erin. It got me thinking of other data that we can be talking about. Jen.
Hi, everybody. I'm Jen Horowitz. I'm the Policy and Research Director for Let's Grow Kids. My fun fact is not all related to early childhood. For those who don't know, 4 years ago, our family moved to Eastern Oregon for my husband's job. He just accepted a job back in Vermont, and in 9 weeks, we are moving back. So if you have a house that we can move into, someone please help us find a place to live, because I'm kind of panicking right now. And I will just add to that, our daughter, we're moving because of schooling and issues. So fun fact about the district that we live in right now, there are 37 kids in 7th grade classrooms. And 60% of our school district is low income. And it's just, we ask too much of our teachers and under-resourced. And when you have a kid with special needs, all they do is stick your kid in in-school suspension. So we are headed back to Vermont. So yes, hot tip, housing, anywhere within 30 minutes of Waterbury, someone please let me know. Okay, thanks.
Thank you, Jen. And congratulations. We're excited to have you back. Katie, Selena.
Hi, everyone. Katie Selena. I'm the Policy and Research Analyst for Let's Grow Kids. I was trying to think, one of the most recent data points that's just been like fresh in my mind is the from the Vermont AUIC survey that showed that 86% of center-based childcare programs are experiencing a staffing shortage, and just how needed like immediate investments are in the workforce. So yeah, I'm excited to be here with you all today to talk about data. Thank you.
Thanks, Katie. Wendy.
Hey folks, my name is Wendy Geller. I am the Division Director for the Data Management and Analysis Division here at the Agency of Education. And my fun data fact is that I get to work with Dave every day.
Awesome. Keely?
Hi, everybody. My name is Keely Agan, and I am the Early Childhood Nutrition Manager at Hunger Free Vermont. And I'm going to share not unexpected data facts, but I'm really excited to announce that we did a focus group study with early childhood programs all over the state of Vermont over the past year, talking about the cost of providing meals in early childhood and barriers and all of that fun stuff. And it's not released yet, but I'm going to share, sometimes data just confirms what we already suspect, right? And so I'm just going to it's also not really exciting, but it's nice to finally have data and qualitative feedback around these barriers to providing nutrition to children in early childhood settings. So the top 4 barriers: cost. Over 65% of programs identified cost as being their #1 barrier to operating a meal program. Paperwork burden came in at number 2 with over 59% of programs identifying paperwork as a barrier. Staffing shortages, again, but specifically related to providing nutrition, came in at over 46 programs identifying staffing shortages as a barrier. And finally, time. Just time to provide the meals. So over 37% of programs identified time as a barrier. And the qualitative piece to this is that even though cost came in as the #1 barrier by far to providing nutrition in early childhood settings, everyone said, Keely, you could give us $1 million. But unless we had someone to operate the child nutrition program, someone who had the capacity and the training, and also infrastructure, like a wastewater permit, we still wouldn't be able to operate a child nutrition program. So again, this isn't great news, but actually having all of this data identified and being able to release a report with this both quantitative and qualitative data is going to be really exciting and really helpful for nutrition advocacy in early childhood as we move forward. So excited to be here. I'm going to have to hop off at 1:30. My brain is all in summer meal food access world, and I will be sharing a lot of that data with you all later as well. So thank you.
That's awesome. Thank you, Keely. And we'll send you the grid that we're building so that you can fill that in as well. Julie.
Hi folks, I'm Julie Lowell. I'm a policy analyst at Public Assets Institute. And it just so happens that I play with a lot of different data sets, not all childcare, but I've been looking at the childcare provider data that most recent release date was April of 22 from CDD, and was surprised to see that compared to pre-pandemic, we've maintained spots for infants and toddlers, but have lost a lot of the preschool and the school age slots in particular. So that really stood out to me. And that a lot of those centers, or those schools, not the schools, but the centers that have had those ages of kids have closed or are no longer having capacity for those ages.
Awesome. Thank you, Julie. And Claire.
Hello, everyone. I'm Claire Waterman, and I recently, as of last Monday, have joined Childcare Aware of America as their Senior Director of Research. So very excited about this new opportunity to dig in specifically to childcare nationally, but of course we'll always be hopefully building Vermont up at the forefront for that. So I don't have any exciting data information. I am really excited that my team has 2 wonderful GIS mappers. And I know that that has been something that's been really valuable, particularly in Vermont, in terms of thinking about access to universal pre-K. We've done a couple of maps with some other things. Really looking forward to seeing kind of where we can take some of our mapping work and thinking about that. But lots of learning happening right now on my part in terms of understanding everything that's going on at CCAOA, but we'll definitely look forward to bringing more back to the group next time.
That's awesome. Congratulations, Claire. So, a part of the reason why Dora and I wanted to start the session with some sort of indicator or data fact is to let folks see there actually is so much happening in the data world across all of our different sectors that we probably don't know about, and probably should figure out how to make those connections more often and share those things. That's not the discussion today, but it's something we want you to be thinking about, right? There's a lot going on. There's a lot of data that people are prioritizing, and how do we think about sharing that information with each other? So for the next 20 minutes, we want to have a really important discussion around how we in the state of Vermont, across all of our different sectors, are thinking about COVID-19's impact on kids, families in the early childhood system, and how are we thinking about measuring recovery? And I think one really important thing to note is that there are folks across the state, in the governor's office, through state agencies in the administration, and across all of our different entities that have already started to think about this, prioritize, think about indicators. And the purpose of today's discussion is to inventory some of that and say, okay, how do we all know what we're prioritizing as we're thinking about COVID recovery? Are we all thinking about it in the same ways or different ways? Are we talking about child outcomes? Are we talking about process? Are we talking about services, access? How are we thinking as a state about these pieces? And I think, one thing that we think about often at BBF, and specifically for this committee, is our role as advisors on early childhood data, our job to monitor Vermont's early childhood system. And this conversation is going to be the first of many to help us develop a tool to say, here's a data development agenda and how we're going to prioritize early childhood data as a state for the coming 5 years. So this is a renewed, for those who haven't been a part of the committee for too long. We have reset the committee, and one of our key charges is going to be, over the course of a couple of years, to put together this comprehensive list of priorities on early childhood data. And within that, to be able to identify, is data publicly available? Do we already have data that we need to answer the big questions, or don't we? And who's responsible for being able to answer those questions? Is this something that state government should have the ability to do? Is it part of our existing infrastructure and systems? If not, where do we need to partner with community partners, with researchers, to write grants to actually support Vermont's ability to answer the hard questions? So the data development agenda is this first step to thinking critically about how we want to prioritize data as a state and what we have as big questions and what's already happening. And then the second piece of this over the next 2 years is to say, we need an interdisciplinary research consortium where we're bringing together state agencies, we're bringing together researchers and community partners through this committee, but in a very specific sub lens to say, how are we actually tackling these issues? And how are we prioritizing writing grants over the next 5 years to tackle these issues, and whose job is it? And really building that coalition together. So today's discussion is the first step in thinking about how to do that. And going back to Katie Northey's comments earlier, we had a really powerful meeting as a systems analysis advisory committee where the biggest themes that came up were, how are we talking about data, accountability, transparency, and measurement? How, if we're going to make changes in our system, if we're putting money in, if we're thinking about creating a change in the organization of state government, how do we know if that's better? How are we measuring change? And one of the most important parts was thinking about the fact that it's not just child outcomes. We absolutely care about child outcomes. We want to see that kids are improving across all different sectors. What else? And how is everyone thinking about it? So what I want you all to be thinking about today, and looking at the spreadsheet, I see that most of you are in there. I'm also happy to screen share for anyone who's not in there. What I want you to be thinking about is, how are we looking at our data? How are we thinking about our content areas of expertise? And how are we knowing whether or not the changes in what we're doing is making an impact? And I want everybody to be able to both, spend a couple of minutes dropping things in to say, here's how our sector, our team is currently thinking about this, or here's an initiative we have underway, or here's a data gap that we really want to be able to answer, and to be able to use this table as a place to compile this information. So again, I want to start, and I'm happy to screen share. And to ask folks, how is your agency, team, or entity measuring outcomes and progress for kids and families right now. How are you thinking about COVID-19 recovery? Is it work already underway? Are you able to name some of that? And I want to take 2 minutes or 3 minutes to have every individual be able to do a little bit of a brainstorm in that table. And while everyone's navigating to the table, I want to take a minute to allow Jesse Suter to introduce himself. And Jesse, the prompt for everybody today is, what is one indicator or unique data point or something interesting from a data lens that you have come across most recently that you're excited to share with folks?
Hi everybody.
No pressure.
Wow. I was literally just digging into spreadsheets from federal educational data. I didn't find much interesting, but it was very confusing. Hi, I'm Jesse Suter. I use he, him pronouns. I'm the director of the Center on Disability and Community Inclusion. We are at the University of Vermont and a federally funded center, and we've got 20 odd projects that are mostly working off of state grants to provide services for children with disabilities. And I'm a faculty member in the Department of Education and do research in special education service delivery and the wraparound process. And all of that was just stalling. Interesting data. I mean, I'm looking at school inclusion, really, for students with disabilities is the latest data that I was trying to pull. And it's amazingly difficult to measure that effectively.
Thank you, Jesse. Happy to have you here. No, that's perfect.
Sorry
And
to be
just to
late.
give you a brief orientation to where we are right now, we just sent a link in the chat to essentially a spreadsheet where we're trying to inventory how our different respective teams across the state are thinking about COVID-19 recovery for kids and families and the early childhood system. So how are you thinking about this? How are you prioritizing recovery metrics? How are you thinking about data, either within teams or individually? And I want to just reflect one more time that yesterday's systems analysis meeting had really intentional discussion around the need for high quality data in Vermont's early childhood system, the importance of transparency, the importance of accountability. And there's a really important opportunity for this committee to support advisement at the state level for how we should be thinking about measuring change and systems change and the impact that we want to see for kids and families, and to support the government accountability committee. There's so many opportunities here. So want you to turn your attention to the spreadsheet. Is there anyone that doesn't have access and wants me to screen share?
Morgan, I just have a question about
Sure.
the finality of the things we might put in your spreadsheet, because they're under a lot of discussion at the current time within our agency. So like, I could put a lot of things down, but I don't know that any of them are happening for sure yet or not, right? And they could change form very quickly.
Completely acceptable, and an important thing to raise for everyone. I think what we want to be able to document right here is, here's how we're thinking about COVID-19 recovery. We know that the Agency of Education, that the governor's office, that the Agency of Human Services, there are a lot of folks who are really paying attention and trying to determine what this looks like. This will be something that is a live, living document that only this team will have access to. This is not something that right now we're trying to make public. We definitely want to be capturing and taking this inventory, but also for your teams to be able to bring this back to your leadership to say, hey, here's how other people are thinking about it. How does this inform our thinking? How is it sparking different ideas for us about how to think about measuring different outcomes or indicators of process? It is something that we eventually would like to summarize and provide to, be an advisor to our agency leaders and to the Government Accountability Committee, but it's not an urgent, we need this to be done this week, that type of thing. So, and Dave, I did speak with Dan and Heather about this as well. So just wanting to flag that for you
Sure.
all.
I think the other reason that we wanted to do this together is that there tends to be some duplication that happens, so that we're using similar data points, but maybe not exactly the same, or we're collecting it in, we're collecting samples from different places and not asking exactly the same question. So is there opportunity for alignment here? And, you know, utilizing resources in a more efficient way.
So I can see that folks are starting to populate different components of this list. There are also likely topic and content areas that are entirely missing. So feel free to add and be shifting. And, you know, I think it's more of making sure that across the board, we all have an idea of what's happening across the different sectors, how it's being thought of, and to have a discussion about what's most important to all of us as we move forward. So let me give you 2 more minutes to fill in a little bit here, and then we'll come back.
So can I ask a clarifying question? Because as
You-
I'm doing this, I'm thinking like the way that I'm engaging in this activity is I'm looking back at Head Start PIR to look at the types of indicators that are available. And so I have indicators. Can I just be plunking those into the, should I be plugging those into the topic and initiative, like column A or column C, or am I overthinking? Probably.
It's totally fine. And however you want to approach this, Renee, if it were me and I were thinking about the Head Start data, I would potentially add a new bucket called Head Start data. The summary would be that it's from APR reporting, and then the list of indicators
Okay, thank you.
in data large buckets type of thing.
Okay, got it.
And then somebody might be able to say, oh, I didn't realize that this was captured in the PIR, and maybe we should be using that in our, whatever, looking at DMH recovery metrics, right?
Right. I think that is the hope, is to help you all see where there's alignment, where there might be gaps, where there are opportunities to think collaboratively about what data we have and what data is missing. And just, again, I think, you know, coming back into the space while also people are still filling this out, would love to have some of you be able to talk about how your teams, whether it's within state government, whether it's private entities, how is your team thinking about measuring COVID-19 recovery? How are you thinking about data right now and all of the challenges related to the pandemic as a starting point for this question?
Just say Google Sheets is not my strong point. And as I'm struggling with formatting, I feel like everyone is judging me and looking at my cursor.
We are not. We absolutely are not. And we can go back and format and do all of the fun things later. And again, we want this to be a living document that this team can keep returning to and talking through as a starting point to the data development agenda. So does anyone want to take a minute to say, you know, here's how we've been talking about this internally, here's how we're thinking about measuring COVID-19 recovery, or here's our approach to thinking about outcomes for kids, families, and services.
So I would just say one of the things that work. So it's right now, of course, again, I'm a week and a half in, that one of the things, as there's a push for the policy folks at CCAOA to be trying to get folks on the Hill to invest in childcare, one of the things that they're quite interested in and that they say the policymakers keep coming back to is what is the supply? And have we shown recovery? So we are in the process of finalizing our annual fact sheets, our state fact sheets that are based primarily off of surveys that we do of states. And although we didn't get anything from Vermont, by the way, just FYI. But also some little data findings, or finding data in elsewhere, but really kind of trying to decide whether what we're seeing in terms of the number of childcare slots that are available and the number of childcare programs that are available, whether what we're seeing is kind of constitutes some recovery from kind of that dip that we saw with a lot of childcare programs across nationally closing. So I think from our perspective, it's kind of that supply piece that, in thinking about, are these investments working, and are we recovering from COVID? So that's kind of the first and foremost thing I think they're thinking about.
Thank you, Claire. And I know Jesse missed introduction. So if everybody, as you're introducing yourself, will you just give your name and where you are, just so that we're all.
I'm Claire Waterman, formerly of EDC, and just recently started as a Senior Director of Research for Childcare Aware of America.
Awesome. Thank you, Claire. Others?
Morgan, I had a little bit of data to share. I sent it to Dora. So Dora, I don't know if you can screen share. I would generally say, I'm still learning about this. But one of the big changes is that the use of telehealth in services. So before the pandemic, it was 0. Then it shot up, and now I have a number about, sorry about this, to tell you the percentage. So as of over the last 5 months, January through May of this year, 23.6% of billable counters were submitted as telehealth. So people are, clients and professionals are continuing to use that option that was made available through the pandemic. I have some information from Children's Integrated Services Early Intervention, which is with children ages birth to 3 who have developmental delays or differences, or their parents have, or their families have questions about their development. And so there was a dip in the first half, as we would expect, January 1 through June 30th, 2020, on all of the performance measures. So we have quite a few process measures and just a couple outcome measures, but everything, went down. And there's anecdotal evidence about strategies that people use to meet the needs. And I guess an interesting question would be, what new strategies like telehealth emerged during the pandemic, and are they sustained? And what impact do they have? Perhaps they increase accessibility or frequency of, sort of dose of intervention. So in general, I think for early intervention, the timeliness of things slowed down. We have a lot of timeline indicators to meet, how quickly respond to referral, how quickly the intervention plan is developed, all those things, when do services start. And those things slowed down for everybody, but for early intervention, we have a little more information about why, and I can't report that out right now, but it is available, and I might be able to share it later. And it just quickly, the numbers seem to be rebounding after the dip, and clients are now having more complex needs, which is a national trend, and also what we're seeing in Vermont.
I think one of the things that I really appreciate about the slides that you shared is that it's not just about child outcomes. And that is what we were talking about. We have to be thinking about the process measures. We have to be thinking about different ways of measuring systems change, access to services, referrals, in addition to the number and percent of children who are ready for kindergarten and are meeting criteria for third grade math and reading and all of those different pieces. So thank you.
And those child outcome measures, you know, they're so important. What difference does it make, right? And they're in performance measure data, they're the things we have the least control over because there's so many other factors.
Agreed. Thank you. We do
You know,
have
one
to
of the
start wrapping. Go ahead, Dave.
one of the really interesting things about the telehealth data that she just presented is people with disabilities get to go see a lot of specialists, and specialist visits are a lot of times like go get a test or discuss the results of a test. So they're not really, you don't really need to be there, right? And so telehealth visits make that so much more easy to put into your schedule and to get done. So I mean, at least to my family, I've found them very helpful. Sorry to interrupt your meeting flow, Morgan.
No, that's okay. I just want to make sure that we have time for the rest of the session today. I really appreciate folks coming together and starting this conversation. Again, this is a starting point for us to have this information in one place, kind of build this inventory or repository for you all to have access to this at any given moment and to be able to update it. I think the other thing that is really clear to me is who's not at the table right now. So what are the areas and the people that are not at the table that we don't have folks to be able to speak to basic needs, to family partnership and decision-making, to families and communities, to other components around systems integration, although BBF and Dora, you and I will have to do some work on that one, and around data-driven decision-making. So again, first of many conversations and really thinking about how this team can come together more consistently and frequently to be data advisors, and for you all to make the connections among each other, to know who's doing the work, who are the point people, how are we making the connections to make sure that we do not have duplication of efforts, and how are we thinking about this in an integrated way. And those are still big picture challenges that we have not finalized. So I'm going to pause this part of the discussion. I really appreciate it. We will continue to use this document in the next couple of meetings as well. And I'll transition it over to Dora.
Thanks, Morgan. And thank you to Anne for saying that it's exciting to see who is here. I love this meeting and this group of people. The next 20-ish minutes, maybe less, maybe 15, is really about the early childhood data updates. So both we started with some of that. We shared some of what the exciting findings and indicators were, which I think was a preview of what might come in this section, but updates of reports that are coming out, of analyses that are occurring, and also surveys or data collection that might be going out. We all know about survey fatigue and just trying to make sure that we are collaborating, aligning, reducing that duplication, and again, aligning those definitions, data collection strategies. We have so many shared priorities, so making sure that when there is a survey going out, if there's one other question that would be able to be added, or one additional answer option that would be able to be added, that would allow for this to be used across 3 different organizations, that is going to be beneficial for everyone, and be until we have this beautiful early childhood integrated data system, that this is a way to really try and start creating that alignment. So who wants to jump in and share about updates and analysis and upcoming data collection efforts?
There's something I would I'm sorry, Caitlin. Because when we start talking about kind of sharing, data from various different surveys with each other, I would just say that maybe part of that process of thinking about it is thinking about what's that data governance look like, because the data sharing, the potential need for data sharing agreements, especially when it's any data that might be protected by FERPA, would be really valuable to just kind of be thinking about that now, so that when we get down the road, it's easier to share that survey information and be collaborative in that way. But other than that, I'll pass it over. Caitlin, you had your hand raised. I just jumped in. That was rude.
No, it was so important because I think I've already run into that issue. So I'm still gathering data and analyzing data for a mixed method study that I'm doing that's funded by Let's Grow Kids. And, I've wanted to use their expertise for quantitative analysis. And I'm like, okay, so I have data, but I don't have the agreement to share with them, right? So having to talk about things and get advice and input has been a little tricky. So I wish we had planned that a little bit better for our paperwork. But yeah, so we surveyed anyone that was enrolled in a preparation program for early childhood in Vermont, whether it was online, master's, bachelor's, apprenticeship model, technical school. We have 94 completed surveys. We are starting to do focus groups next week to learn more about their experiences. So it's really exciting to kind of figure out what are the supports, what are the challenges, what do they want, what do they want to improve, what kind of things do we need to work on. Yeah, I'm loving it. And as a qualitative researcher, I can't wait until the focus groups, because then I can feel a lot more confident in what I'm doing. But it's really exciting.
I mean, I can just report out that I am part of my grumpiness these days. I'm in the throes of my 5-year strategic plan development and needs assessment. So the last needs assessment that I did, I think it came out in 2018, maybe it was 19 data, I'm not quite sure. But so I'm pulling all of that together, and that's it spans Head Start priority areas. So it's everything from partnerships to workforce to data to supporting children with disabilities, supporting children who are homeless, access to timely health services, family engagement, you name it, it's probably in there. And that information is collected, and that report is done both with a combination of the federal PIR, and we're using the I have to look at what year it is, 2021 PIR data, which is the last time it was submitted. And the Vermont grantees are so generous, and they also respond to like 139 question survey, all about their levels of relationships, partnerships, collaboration, satisfaction with various components of the system. So that's due 7/1. So anytime after 7/1, that should be coming out. So maybe at the September meeting or another meeting too, Dora, I can just do a little bit of a recap of that to see what might stick out for folks.
That would be wonderful. And good luck with the last crunch.
I always set myself a deadline that's not the real deadline, and I work under that, and then I have gone flying past that deadline. So now I'm faced with the real one and just, stressing myself out. But thank you.
So I would just say also that our state fact sheets should be coming out in the next couple of months, probably, maybe a month, maybe a couple of months. They're in the process of being finalized and going through, we call it MARCOMs. You guys, all new acronyms that we get to learn when you've joined a new place, but marketing and communications. So. Yeah, Renee, we can connect on that. Now we have an in.
I I mean, I just think it's so important because I've been watching our non-response rate to that survey for years. And again, just trying to figure out who's responsible, like who's on first.
And I think that's the hard part. One of the things that, without, disclosing kind of other stuff is I also want to revisit the survey and make sure that the language. So one of the things that can be tricky about childcare across states is that each state uses very different terminology for things like licensing and stuff like that. And so when you look at the Vermont fact sheets, you'll notice, for example, that family childcare, it says that there's like 20 family childcare providers. And I think what's really super important about that is the language that's used in Vermont to call them registered versus licensed. And so this is one of the things that kind of I flagged right away was, of course, I looked at Vermont first. And I was like, wait a minute, this doesn't feel right to me, gut check. But I think that some of that stuff, I mean, it is important because I feel like questions would have come up if there were responses. So I think it's not like anyone's fault. I think there's like 1,000,001, we want to reduce an amount of surveying that we're doing of the field as well, right? But there's certain data that needs to be collected in order to do some of the things that we do. So yeah, I think you're right. It's like who is responsible, but then also kind of how are we, does that survey feel relevant? Does that survey feel important? What is coming out of it? So I think there's some work to be done, in terms of making sure that it's understood why, and also that the survey actually asks questions in a way that you have to ask questions in a different way across states in order to get the same answer. So you have to ask the question, and it was the same problem with the NSECE data, the National Survey of Early Care and Education. You literally can't get any information on which families in those data files receive subsidy, because you can't ask subsidy questions across states in the same way, and families are really bad about answering those questions. So anyway, I went on a tangent. It's data related. It's a data related tangent. Though, yeah, we can definitely connect on some of that stuff.
Again, shared definitions, right? And trying to figure out how to get the answer to the questions that many of us have. Dave, I know you have to jump in like
I do.
a minute. Any like super quick updates?
For my team in the summertime, it's not so much about the reports that we're producing. All the data is coming at us at this time of year because we're getting the end of the year data for schools. We're going to be starting a Head Start collection. So I think each summer from the various data collections I do, it's probably 1.5 million rows of data that I'll be getting over the next couple months in various forms, tables, and submissions. So really the data work that my team's doing is around validating data and trying to make sure that everybody is, using shared definitions, that it's clear what we're trying to measure from the metrics. That was one of the big things that we found when we went to the SLDS model, was that data managers at the SU level didn't know why or what funding was connected to the information that they were inputting for us. So they didn't know why they were checking in a box around homelessness for students or things like that. And once they did, it sort of upped the value of getting it right for them, didn't it? So that's a big deal for us. And I am sorry, but I'm supposed to be hosting the 2:00 meeting, so I should get moving. It was nice meeting everyone, and I will look for the recording on the last half hour of this meeting. Have a good day.
Any Let's Grow Kids updates?
Well, I see Jen just took herself off video, so I'll just guess that she's solving a childcare crisis right now of some sort. I wanted to reflect on kind of what Claire and I think Renee were both talking about, that sometimes from our perspective as a nonprofit and not a state agency, sometimes when people talk about that there's no data, it doesn't mean there's no data. It just means that the person that wanted the data didn't know where it was or didn't know anyone was looking at it. And so I'm thinking of two things. One is, Jen, sorry, I'm going to do it. Like Let's Grow Kids produces Stalled at the Start every 2 years, and that analyzes all the supply and demand, and it actually does it over time. And so if you wanted to know if there were more or less capacity in the system, that report's available and it's on our website, and it's been available since January or February this year. But like, but that's not a state document, right? That's just a nonprofit producing this based on state data. So it's a little fuzzy whether or not it's official in that way that I think childcare aware would like it to be. And it's certainly not up to us to report that because we're not the entity. But the other example I was thinking of is I saw a presentation from Opportunities Exchange at their annual conference or whatever in Texas. Somebody shared it with me, where they said, we're going to show you this data from Los Angeles about the supply of childcare. And I forget when it's from. It's from like 2018 or something. And that's the most recent that's available. And it's in Los Angeles, and it's not like we couldn't find it anywhere else, and we couldn't find it any more recent. And I was like, we count that stuff every year, every other year, whatever. So anyway, sorry, that's just something that makes me a little crazy, is that I don't know how to bridge that exactly, because anyway, I don't know. So I just wanted to point that out, that sometimes there is data.
I think it's really important, Erin, and it's one of the reasons why we want to put together this very collaborative public-private document to share priorities around data, so that we can say, here's what we know about the data, here's what's publicly available, here's what's the role of state government within that data, and here's where they need additional capacity. What does that need to look like? And how do we have it be a partnership so that when some of our partnered agencies, entities, organizations, nonprofits are producing rigorous research or data, that it is seen as Vermont's documentation on X, Y, or Z? And how are we thinking about it a little bit differently versus from a lens of advocacy, which I think our state leaders tend to push back on, and they really struggle to understand the value of the expertise that we really do have in Vermont on some of these topics and issues. And I know we don't have as many of our state partners in the room still, but I know that there's agreement that we need additional capacity on the data front. So how are we going to tackle this collectively?
And I wonder, Morgan, too, I mean, I keep harping on the data governance, but I just feel like that is such a gap. It continues to be a gap. We made such good progress on it under Race to the Top, and it's just another dagger. But in this conversation, like, of who's responsible for what and what formally counts, I think there might be a place for that within our conversations within data governance. It's beyond governance. It's really about partnership. But I just wonder within that process if we can, to use BBF's terms, set a table and really codify that. Because Erin, like I said, I hear you, I see you, and it is crazy making of we've got this data, and like if it just doesn't have a certain type of watermark on it or a logo on it, that we don't look at it in the same way. So I do think kind of at a systems level, we need more agreement and documentation of that agreement about what counts, who's doing what, and how we're using it. Because I'm really, it's less about that and more about not knowing where the data live. I mean, true, Claire, but I guess in the vein that I'm in now, I'm thinking about, we know where there's lots of data, but when we get into this territory of who collected the data and what was their methodology beyond the data, and if we disagree with their methodology, right? It's like that kind of little nitpicky stuff for me. It's the data is out there. It's that all that other stuff. If we can work on our partnerships and not just how we share the data, but our expectations around who's sharing what, I think that would put us in a better spot than where we are currently.
I agree.
I know Anne
sorry,
wanted to say
Anne.
something that I just wanted to clarify. I was not complaining that people aren't using this data. I just wanted to raise this thing about we have this narrative of there isn't any data, and I think there actually is a lot of data. We just don't know how to grab it.
Yeah,
I
and
completely agree.
and just to piggyback on that, it just, yes, and I'll just stop. No, I'll just stop. I think we are on the same page, not complaining, but it's good data. And so often I would hear from folks after doing myself, right? And this happened with wage survey, is it's not perfect. And we understand the limitations, but that's where it's just important that you're articulating your assumptions and you're clearly communicating those limitations. It doesn't mean that you don't pay attention to it when it's there. It's the best that you have, and you have to figure out a way to work on it. And I think from my perspective, I see people get to that, and they see the data and they look at it and they have it, but then they say, well, they poke holes in it, and which is fine, but if it's the best that we have, let's figure out how to improve it in kind of that CQI process, as opposed to being like, no, we don't think this is good data, and so we're just going to shelve it, like that kind of a thing. It's that we need that CQI and that continually moving forward piece.
Right. So Renee, to answer your question on data governance, for those of you who are active in the systems analysis, I think it's really important that if you haven't provided feedback directly on the need for data governance and an early childhood data governance council to be reinstituted related to the systems analysis and the development of this integrated early childhood data system, you have until the 24th. And it's something that this committee, in the absence of a data governance council, is holding and working to move forward. So just as a reminder, and Anne, I know you want to make a comment. Dora, I know we've got a wrap as well. So
it's very short. I just wanted to say that under the race to the top, the work that Renee is referring to, there was a lot of resistance to the idea that private, nonprofit, even pediatricians, people like that could be data stewards that we would want to consider and have part. It was really a focus on public data stewards. And I think that the idea that you start with that and then expand later is erroneous. I think we need to start broad and keep it that way.
any other data updates? BBF has too many, so we'll put them in the chat possibly. Jesse, anything from your team?
I mean, I guess maybe express some solidarity with Renee. Next year, we have to apply for our 5-year center grant, where we have to create a work plan, and it needs to be based on a community needs assessment. So I'm excited to hear there's lots of data out there. We will be using it to sort of set the foundation for a lot of the work that we do. Most of what we do is school age. We do have a couple of projects that focused on the younger kids. I mean, one summer project I have to dig into some of that is we just finished up a learning series called Scope, which was focused on families, broadly speaking, that have been affected by the opioid epidemic, and in particular, infants born with neonatal abstinence syndrome. So we did a learning series about that, but it was a partnership with the University of Wyoming, and they had one of those many hundreds of question surveys for all of the people that were kind enough to come to our trainings. So we're going to be digging through that data. It was more robust than your typical training survey, and we've got some follow-up data that's coming in now. And so I'm just working on getting the numbers up so I can have some confidence in that. But yeah, we're hoping it has an impact. The whole goal was to try and get the pediatric community and the healthcare community to work more closely with children's integrated services and social services. We do a really good job on the healthcare side for these kids and families. And the state was expressing a lot of need for better connections as the kids get older and need more kinds of social services. So yeah, so for folks that are interested in that topic, in a couple of months, we're going to pull together a group, share the data, and talk about how the state might want to move forward with that.
That's awesome. Thank you, Jesse. For the sake of time, I'm going to very briefly run you down the list of BBF data related initiatives. And if folks are interested, please reach out and we'll send you links to what we have. We are just finalizing our contract with the national consultants who have done Vermont's early childhood, Vermont's child care and early childhood education systems analysis. We're calling it the systems analysis. Terrible title. Their final report is due to the legislature July 1st of this year. And we will be holding a public webinar on July 11th for the final product and the recommendations to make those public. Thank you to those of you who have been weighing in and been a part of that process. I think that your feedback has been instrumental. Dora and I have been working on this idea of the data development agenda. We did pick one topic area as an area to start. We started with pre-K. So what we've done is taken everything we know about all the data gaps from everything we've known about Vermont's history and data gaps related to pre-K, and we've built a similar structure to what you just filled out today, just on what we know about pre-K, limitations, identifying all of the different areas and opportunities. And so we'll take what everybody has put together today, eventually over the course of the next 5 years, and do that for each of our topic areas related to early childhood. But that's a really exciting development on our end. As Dora mentioned earlier, we just in the last month or so published the exclusionary discipline data brief. And as of July 1, I made up that date, but I believe it's as of July 1, there's a law taking effect that tasks Building Bright Futures to support interagency and cross-agency ability to review all of the data related to early childhood exclusionary discipline, to develop some shared definitions and communication and support state agencies in the guidance, as well as statewide best practice for how we're thinking about implementing and reducing exclusionary discipline. Yes, that is also a part of it, Renee, gaps in data and looking and very closely reviewing the task force's report there. Another one that we just mentioned earlier is that we've been supporting CDD and Children's Integrated Services with a data brief called Continuous Quality Improvement in Children's Integrated Services, specifically families' experiences from a perspective of those who have received early intervention, which is really exciting. And that's something that we'll be publishing over the course of this summer and hoping to present at the AUCD conference in November. So the Association of University Centers on Disability. Jesse's team is actively engaged and is one of the centers for the state of Vermont. And there is an upcoming survey that our team is supporting the Families and Communities Committee in putting together. So it is a follow-up from the initial PDG survey called the Family Engagement Survey, and we'll be presenting more information to folks about that. But we're really excited to have that be a truly family and partnered opportunity with families to ask what questions they think need to be asked to families about their experience with service access and being partners and being valued and having shared decision making. So really excited about that as well. Just a few things, lots of data efforts though. It's really exciting.
There's a lot of super cool stuff going on. And I'm sure that we missed a lot. I will be sending out the notes and hopefully we'll get some more information back from people who weren't able to be here about what we might have missed from them. And Erin, I'm so sorry, but I would love to give you the floor for the rest of this time to share about the annual economic impact report.
Okay, sure. I actually wasn't really sure I needed all that time anyway. I figured I would just give you like a quick glimpse of it and then the link to the report, because it's a 20-page report and I couldn't possibly like get into that level of detail. But I appreciate the opportunity to tell you all a little bit about it. And it seems like it picks up a few of the threads of this conversation a little bit. in the idea that it is designed as sort of a synthesis summary of like all the data we could find about the economy and childcare, like from all the places. It is not based on primary data collection. It is really based on like a very broad secondary research analysis. So that's like the first thing is that I feel like it kind of touches on that. And what's the other thing I was going to mention about that? Oh, also that it was designed, the main purpose of this economic report, and I'll tell you in a second, I really hate the title. I did not come up with the title, and I'll tell you the reasons why I prefer not to use the title myself. But anyway, the purpose of the report was to have a very simple to understand and coherent story of the role of childcare in the Vermont economy and the effect of making more public investment on the Vermont in childcare on the Vermont economy. Okay, and so we wanted it to be simple, really simple, and coherent, right? Like we wanted to piece all the story together because people kept saying, oh, we should do this report. Oh, we should do this study. We should do that study. And I kept saying, you know, I think a lot of these things have been done, maybe not done exactly in Vermont or maybe not done exactly in this way. And so rather than try to do yet another survey, you know, when we talk about survey fatigue, we contracted with a consultant / writer who has worked on economic reports in other states to take all of the sort of raw material that existed and pull it together in what we think is a really coherent story. And then we took all this data that was then in one place and could make this coherent story, and we turned it over to our communications team. We call them comms, by the way, Claire, not Marcom, just, you know, for fun. And they created a lovely sort of infographic that represents kind of the summary of all of this. So that's what I'm going to share, if that's okay. And then I'll put the link to the whole report, which is on our website, so you could find it pretty easily. And I will talk, while I put this on the screen, I'll just kind of talk through what it does and doesn't do. And you're welcome to like toss questions my way. Don't put them in the chat because I won't be able to see them very well. Does that sound okay? Sharing my screen. All right, so interesting. Okay, sorry. Again, don't judge. This is not designed to be a scientific economic report. I do have a master's in economics. I know this is not an economic impact study in the like usual economic sense of the word. But if you imagine the word impact in the sort of more colloquial use of impact, then it sort of makes sense. And the other reason I hate the title is, so I don't really like calling it an economic impact because I feel like for economists, that creates certain expectations, which it really does not do. But the second reason is that it's called the annual economic impact of a comprehensive childcare system in Vermont. And while this infographic is that, the report itself is not just an annual effect. The report is much bigger and broader than just the annual effect. So it's a little bit of a misnomer. Anyway, so this is the infographic. I think it is, so, you know, Let's Grow Kids is an advocacy organization, so you should keep that in mind when you look at this. However, I will say that we hired someone to keep us honest as these numbers were crunched and as this report was written. So, so it is not untrue either, right? I think it is the best, as we talked about earlier, it is probably the best data available about what would happen in Vermont if we made the public investment that Let's Grow Kids is asking for. There is nothing, and that the math and that the dollars are as good of numbers as we could find in the world. So anyway, let me see. Let me make sure I covered all of the like limitations and methodology issues that Oh, I wanted to mention before I go any further, if you really are into the economics and want to read a like super robust economic analysis of childcare and paid childcare on the economy, I highly recommend going to ced.org/paid childcare, where they've done a series of reports. And we had hoped to be able to use those more in this report, but the timing just didn't work. They just have been coming out with those over the last few months. So, and this was released in March. They appear to be frozen. Okay, so what we're looking at is an infographic that reflects the number of children that if we made the public investment that Let's Grow Kids advocates for, 8,752 additional children would have access to childcare, full-time, high-quality childcare, and 5,000 additional parents, particularly mothers, would be able to participate in Vermont's workforce. As far as the second column, so the first column is about the effect that this investment would have on children and families. The second column is about the effect that it has on the childcare industry or the industry's effect on the economy as a whole. And so if that investment was made, we would expect there would be 676 new childcare businesses established, in addition to any expansions this would be 676 new businesses based on the way the childcare industry is sort of divided up right now. In order to serve 8,752 more children, we would need 676 more childcare programs. To serve 8,752 more children, we would need 2,500 additional early childhood educators. I will acknowledge that that number particularly is based on outdated information, because it's based on the last report that came out of the State Child Development Division, which I'm going to get this kind of wrong because I can't remember, but I think it came out in 2020, but was based on 2019 data or something like that. And then Let's Grow Kids wrote a subsequent report that analyzed that data and came up with this estimate. And so it is pre-pandemic and it is a little bit out of date, but again, it's the best available data that we had. And it's not crazy wrong either. It's just, we don't know quite how confident to be about it. So anyway, so then we step down to the next row, and that is showing what I call the sort of direct economic impact of making that investment and serving that many more children and families, establishing that many more businesses, et cetera. And so $99.1 million in increased wages for families who are already have their children in childcare. And all this is doing is saying, if people didn't have to pay 30% of their income on childcare, but instead we're paying 10%, this is the savings. This is what you would see returned into families' disposable income. Okay, so that's what that is, and it's based on the number of children that are currently in full-time care as described in the Stalled at the Start report. And it's also using the median income for families with young children in Vermont. So that's how we did those estimates. Let's see. And then the next number down, going down the column, $375 million is now taking those additional 5,000 parents and looking at the bigger effect on the economy, that if more people could put their children in childcare, this is what the larger effect would be on the economy, not just the savings for the number of families that already have their children in care. Okay. I hope your minds aren't glossed over yet. I'm trying to look at people's faces, but anyway, so, and then you add it up and that, go ahead.
Claire is putting a ton of questions in, and
oh my God.
No, no, it's okay. This is just generating a lot of questions for me. I just it's not, Don't
Okay.
worry about it.
I would
Good.
be,
No
I'd
worries.
be happy to chat more, but I can't read the chat and
Good.
look at
You're
my screen
good.
at the
Keep
same
going.
time.
Keep going.
All right.
Erin, I'm chiming in on chat.
Yeah. Okay, great. Thanks, Jen. I appreciate you. The other thing, so the other column is the childcare industry. And so the numbers there are $212.8 million in industry growth includes, I just want to check my notes here. The new revenue, the jobs, and increases in wages, right? One of the things in our public investment in our, the sort of policy that we propose is better wages for early educators. And the report actually has a really nice graph that shows where early educator wages are compared to other sort of similar some college required fields. And so I think it puts into context where wages of early educators fall. And so if early educators were paid the wage that would put them where we believe that they ought to be, which is about a wage similar to a kindergarten teacher. And we had 676 new businesses, et cetera, and 8,700 more kids in care. $212.8 million is would be the effect of doing that. And then the $68.8 million is what we call economic spillover. That's because these businesses buy a whole bunch of stuff, right? They buy diapers, they pay contractors to build fences, they buy playground equipment, they buy apples, right? Whatever. They buy a lot of stuff in our local economy. So that's what that $68.8 million is. And that is the very, very brief summary of what is in this report. There is a lot more data in the report, a lot more about what the childcare industry really looks like and what the regulations are and what that means for the industry and some of the constraints. And I'll also mention that that report has 4 pages of references. So the 20-page report has 4 pages of references. We did not take it lightly. The idea that this was meant to be a sort of synthesis of secondary data. So, so it's all there and documented, and just checking my notes, making sure I didn't leave anything out. Anyway, I'm going to put the links in the chat for all of you. I'm going to stop sharing. This this infographic is in the report on the 2nd page or something if you want to see it. Anyway, and you're welcome to ask me questions. I'm just going to paste these links in the chat because I haven't read your questions in the chat.
Erin, I put the publications page link in already.
Oh, thank you.
You're
okay.
welcome.
Should I put that CED link in? Did you do that?
Claire posted that.
Yay.
We're all throwing the links in.
You guys are the best. Right. I can.
We're all a team. We're all in this together.
So appreciate you. Anyway, all right, I'm going to just flip up through the questions, but shout them out if there are any.
I guess the one question I have that would be helpful, and I'm sure it's in the report, but would be what percentage increase does this represent? So when I kind of look at that infographic and I think, okay, 676 new childcare businesses, like that to me seems like a pretty big increase in childcare in Vermont. So I just wonder where that supply is coming from. I mean, and that's not the purpose of this, right? Like the purpose of this is really to show why it's important. I guess the problem then is who's going to solve that supply issue. But anyway, this is super cool, and the infographics really clear, and you did a nice job presenting it. But that was just those were the questions. It was really just the percentage increase.
I gotta tell you, and I don't have the percent increase right at my fingertips, but I will tell you that when I was calculating it, I was like, that can't be right. That's enormous. So there are about 950 just early care, right? If we exclude the after school programs, because that's not really part of this report. There's about 950 in the state. It's a little bit, I think it's a little less in the last quarter, but and it's been pretty steady around 950 for a year and a half.
Okay. Yeah, so that's a big increase.
It's a big increase.
Yeah.
But keep in mind that increase is based on the percentage increase in children.
Mm-hmm.
You see what I like? It's there's a corresponding increase there.
Mm-hmm. Yep. Interesting.
So we need full-time childcare for a lot more kids. And of course that's what we've been saying all this time, right? Like that's what Stalled at the Start says. This just kind of flips it a little bit to look at, well, we know we need more slots in all the places. This is really looking at, well, how many actual businesses would that be likely to take based on how we see the industry right now?
Cool.
Anyway.
Thank you.
Yeah. Okay, and if you ever just want to talk about it, I'm really happy to do that. I worked really hard on this for a few months, and then it kind of got a little bit shelved in February, and then it like all of a sudden was out of my hands and getting launched in the world. And so so I'm kind of excited, but I haven't really been able to talk to anybody about it. Okay.
Thank you for sharing and for the framing. And I know this group is all about like the methodology and the limitations and the purpose. So I really appreciate that initial framing, and then the way that you didn't go through the 20-page report, but really focused on this on the infographic. I think that it is so important to see that the visualization of information and data is so key when we are telling stories, when we are conveying information. The way that we do it is so important. And I think this is a great example of sharing that simple-ish to understand implications.
Thanks. To be totally candid, that report was written to be able to produce that infographic. Like, we didn't really have any interest in, and that's why nobody hears about the report, because that was not the primary purpose. It was that we needed real data to be able to make a simple infographic. We didn't want to be light and fluffy about it. We wanted it to be like as like rock solid numbers as we could.
What I love about it is it shows the growth potential, right? And it points out other gaps, right? So we're not just talking about children that aren't getting care, slots that don't exist, teachers that don't exist. It's also thinking about, okay, well, if we are going to have that many, 676 potentially new centers or new areas for children to be served, what infrastructure do we need to support that? Right? Like, how many more people do we need at the state level? How many more people do we need who are actually going to, I don't know, I'm thinking in very higher ed, early childhood brain right now that I can't get out of, but like, we are expanding our enrollments while we are cutting down our programs, right? Like, we do not offer leadership programs here. How are we going to certify 676 directors or leaders? How are we going to, right? Like, there are gaps in our infrastructure as an early childhood system that make that growth really, really difficult. So yay, infographic.
I think another problem, and this is interesting, is when I hear us talk about the optimal salary being that akin to a kindergarten teacher. And I think we really need to recognize that the K-12 sector is also struggling in terms of teacher shortages, and Vermont teacher wages are absolutely abysmal, particularly compared to the rest of New England. And so thinking about, and I'm not saying that you're comparing, like, I think that it's appropriate, right? Like, that's what you have to go off of. But unfortunately, the situation that we have in Vermont is that we've got a teacher shortage, an educator shortage K-12 that I think is probably in large part due to like someone with a master's degree making $42,000 a year, and they could go to Massachusetts and start off making $65,000 to more $1,000 a year, right? So I think that this is all intertwined, but I think that this is a huge step forward in understanding kind of what is the context and what could be the economic impact if everything else stayed the same. What would happen if we moved it forward that way? But I mean, this is probably a place where some real communication between the early childhood community and the K-12 space, and thinking about how do we support the educator shortage efforts in both sectors simultaneously could be really valuable.
I mean, I'll just add in, and I see you too, Anne, but we also have shortages with early interventionists and speech and language pathology, right? Like it's across the board in early childhood. So yeah, it's like all boats, but I recognize you can only, focus on one, but I don't want, we continue to not quite really embrace when we're talking about the early childhood workforce. It's not just teachers and folks working in classrooms, it's other folks as well. And I think everyone in the industry is often underpaid. And yeah, like you said, Claire, if I can drive a couple hours or relocate to somewhere else in New England and get $20,000 or $30,000 more, like, why not?
This conversation and just our conversations earlier really highlight for me how important this group is, right, in connecting us as researchers, but also hopefully in the future, as we are designing studies or putting in grants, like really sharing out those ideas so we can get input and just really make sure that we're adding that extra question to the survey, or we're doing something to really help each other out and add to the data that we can use.
And I think that, again, I knew peripherally about the qualitative work that you are doing, Caitlin, but that feeds into your question, Claire, and the I don't know if we're still calling it a pipeline, but I don't know what the other word would be for the early childhood workforce. And so all of these things coming together, absolutely. And I think that we as sort of this group and as a state are coming to recognize the importance of qualitative data and being able to fill in the gaps, and because we don't have the perfect data. And until and we're never going to have perfect data, but the qualitative information is so important in being able to inform policy, to inform how to better support everyone. And did you have a question or comment? Oh, okay. This was really exciting. I'm so glad that we were all able to come together. And our next meeting is going to be in September. So September 15th, same time, 1 to 2:30. And maybe we will hear about the Head Start needs assessment. And I'll get a calendar invite out shortly, as well as the notes and the recording.
Thanks, Dora.
Thank you all.
Thanks, everyone. Good to see you. Oh, Claire, Claire, can you stay on? Avery's right here and she just